Hello again, everyone, and welcome to another remote edition of the Oklahoma News Report. I'm Rich Lenz. April 30th, that's the date Oklahomans are circling on their calendars, the date when hopefully life begins to return to some semblance of normalcy. Are we on track? The per-day death total spiked ominously this week, yet the number of hospitalizations is going down. Like everything else associated with the COVID-19 pandemic, it's tough to say. In the last week, there have been 50 deaths in a 7-day period, total deaths 88, and almost 1,800 positive cases. The overwhelming majority of the fatalities are in the 65 and over age group, but there are now 2 in the 18 to 35 demographic, including a 22-year-old Tulsa man. Oklahoma County has the most positive cases with 413, followed by Tulsa with 314, and then Cleveland County with 236. More men than women are dying of COVID-19 in Oklahoma, 48 to 40. On a good note, still 80% of all confirmed cases result in relatively minor symptoms, and state leaders are sounding cautiously optimistic.
Yesterday afternoon, we had 407 patients in hospitals across Oklahoma with COVID or COVID-like symptoms. Last Monday, we had 560. We are seeing proof here in Oklahoma and across the country that our social distancing is working. We have 5,600 hospital beds in Oklahoma, 958 ICU beds, and almost 2,000 ventilators. And our peaks are right now in our models are showing we're going to need 500. Some of our internal modeling is showing a peak that's moved out closer to mid-May to early May. Continue to pray that we're going to flatten this curve and we're not going to see the spikes that they've seen in New York, Louisiana, Michigan.
Every day now it feels like there's a new heartbreaking story about a wonderful person in our community who's passed away as a result of it. I do want people who have this, you have a community here that is rallying behind you in a way that it has never rallied behind anything ever before.
I'm starting to hate this virus. I hope you do as well. It knows no boundaries, not geographic locations, not race, not gender. Bottom line though, right now in lieu of tests, if you're symptom-free 7 days, fever-free 3 days in a row without the use of fever medication, then we are calling you recovered. We'll continue to track that.
And what we focused on is maximizing the amount of PPE that we have, trying to make it useful as long as it can possibly be useful, and make sure that all of our healthcare workers have what they need to do their job safely.
At the same time, if you are short on PPE or your hospital is asking you to preserve beyond the CDC guidelines, I need to hear about it.
So keep in mind, 4 weeks ago, our staff was processing our traditional and average 1,500 to 2,000 unemployment claims per week. Since that time, we're at unofficially a number of 135,000. We've added over 100 agents in the last 2 days. I realize that this experience has been frustrating, confusing, and painful, and that's why we're making these changes.
Shape your future. Start here at 2020census.gov.
Now it's time to fill out the once in every 10-year census. For every missed individual, that's about $1,700 that will not be sent to local governments for these vital public projects. And right now, Tulsa has only a 41.5% participation rate compared to Oklahoma City's 44.8%. So take just 5 minutes to complete the census at 2020census.gov.
I know how badly many of us want to get our lives back to normal, but what we do together over the next 3 weeks will significantly impact what we can do after April 30th.